Okay, so we're just going to do some indirect blood pressure measurement of the systolic blood pressure, and we're going to do it using the oscillometric method in this dog. So the first thing to do is select your cuff size, and you want to make sure that the cuff diameter is roughly 50% of the radius of your patient's leg. Okay, and then there's an arrow that indicates where you want to place over the artery, and we're going to go just above the carpus and get the radial artery here. Okay. So we just pop the cuff round there. You can see that's fitting quite nice and snugly on his leg. And we just connect the blood pressure cuff up to our oscillometric monitor. And we hit start. And that's it measuring there. There we go, so it's giving us systolic blood pressure of 128 millimeters of mercury, which is normal. These often can give you a heart rate as well, and they'll give you a diastolic pressure, but the heart rate can be a little bit unreliable, so you should always check that by auscultation. And when you're checking blood pressure, you should always take at least 5 measurements and then average them out across 5. Particularly if the dog's quite stressy, things you want to give it a chance to settle down before you believe the measurements.
Always make sure that the limb that you're measuring the blood pressure from is level with the base of the heart, or you can get inaccurate readings as well.
111. So 128, 111, they're both pretty similar, so it's probably reliable, but if you're doing this in practice, then you want to obviously make at least 4 or 5 measurements and then average them across. Okay.